People are joining. We'll give just a couple more seconds. I see a lot of names popping up. All right, why don't we get started? So I'd like to welcome everyone to Wellness Wednesdays. This is a special 15-part series that's produced by the Society for Integrative Oncology. My name is Lee Leibel, and I'm delighted to be your host today and for the rest of the summer. And I am the chair of the Yoga Special Interest Group for the Society for Integrative Oncology, and I work at Columbia University Medical Center. I have a mind-body practice working with cancer patients at all stages of care. So the purpose of our Wellness Wednesdays, we call them the Lunch and Learn series, is to introduce you to the breadth and diversity of evidence-based or evidence-informed mind-body practices that can help us better manage stress and reduce anxiety, cultivate resilience and compassion. All really important things to have skills to manage during these uncertain times. So today we have a really exciting program for you, and the topic is music therapy. So the title is Music in Medicine, the Art and Science, and we'll take a look at the clinical application of music in oncology and in vulnerable populations. So I am really excited to introduce our two special speakers today, who are also my work colleagues. We all work at New York Presbyterian Hospital in New York City. It's a really big place. We work in different buildings and different departments, but I extend a warm welcome to the two of you on Zoom today. Thanks for joining us. So Missy, let me introduce you first. So Missy Hall, and we're going to use first names for this informal roundtable discussion. We agreed to use first names before we came on. So Missy Hall is a licensed creative arts therapist and a board-certified music psychotherapist. She works at New York Presbyterian Family Peace Trauma Clinic Treatment Center, and she works with children from birth until the age of 5 and their primary caregivers. And this population has experienced trauma of some sort, including sexual and domestic violence. So Missy, thank you so much for joining us today. Oh, and I also want to say Missy has her Master of Arts in Music Therapy from New York University. And welcome, Missy.
Thanks for having me, Lee.
Yeah, and now I'd like to introduce my colleague, Marissa Impel. Marissa is also a licensed creative arts therapist and a board-certified music psychotherapist. She works at New York Presbyterian Columbia University Medical Center in the Department of Rehabilitative Medicine. She works in the adult inpatient population across all the different units in the hospital. Marissa also got her Master of Arts in Music Therapy from New York University, and she did her postgraduate clinical training in oncology and neurology, hospice, palliative care, and trauma. So welcome, Marissa. So delighted to have you with us today.
Thank you, Lee. So happy to be here.
So just quickly, so we have 30 minutes together. We're going to cram a lot of information in this 30 minutes. We've allowed the last 10 minutes for your questions and answers. So as the speakers are talking, feel free to use this chat function down at the bottom to write in questions. And we can also do some live Q&A then too. Missy recorded a 20-minute sound bath meditation that has been uploaded to the SIO YouTube channel. So when this is over or at your convenience, please pop over to YouTube and experience a sound bath meditation. So let's hop in. Marissa, can you explain to us what music therapy is and what the educational requirements are for a music therapist?
Sure. Thanks, Lee, and hello, everyone. It's really an honor and a pleasure to be here with all of you today. I want to say thank you for taking some time to come and hear more about music therapy. So, for those of you who don't know, music therapy is defined as the clinical and evidence based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. To become a licensed and board certified music therapist, one must first complete a master's or a doctoral degree in music therapy, go on to complete a minimum of 1,500 hours of on site internships, at which point the clinician is eligible to sit for the National Board Certification Exam. Upon earning the board certification credential, music therapists go on to complete an additional 1,500 hours of clinical contact time with clinical supervision, at which point the clinician is eligible for New York State licensure as a creative arts therapist. Music therapists are trained in psychotherapy and use the relationship between the patient and the therapist in the context of the artistic process as a dynamic force for change. Music therapists have training in areas that include assessment and diagnosis, clinical practice, and human development, as well as the use of music to provide primary psychotherapy. So, Missy, now that we've laid the groundwork for how music therapy is defined, can you talk a little bit about what that looks and sounds like, and talk to us about some of the guiding principles within music therapy?
Sure. Thanks, Marissa. And thanks again, Lee, for having us. We really appreciate it. So, what does music therapy look and sound like in the room? As human beings, we are inherently musical. By that, I mean that our bodies are constantly in motion. And so that begins with our very first rhythm, right? Our heartbeat. Our breath is experienced as tempo or phrasing, and the synapses in our brain is firing in specific rhythmic and temporal patterns. Even our blood flow is rhythmic. So, as music therapists, we are looking and listening to a person's individual music. So by that, I mean either a musical embodiment or expression, how they look, act, sound, interact with others, or maybe by music that they might be making with us, either instrumentally or vocally. So to break it down even more simply than that, music therapists are listening specifically to an individual's musical elements. So what are the elements of music, right? You might remember from your first grade class, way back when you were learning to play the recorder. Rhythm, tempo, sound, dynamic, all of these things are musical elements. And so as we engage in musical relationships, we're listening for these things. Rhythm, what is the person's repeated movement or sound? Do you experience them as very regular, predictable, reliable? Or maybe you might experiencing them as erratic or disorganized, out of sync, right? Tempo, how fast or slow are they? We've all met that person who talks like this and they talk right at you and there's hardly any room for them to breathe, right? An allegro tempo. Or maybe you've met that person that has a very slow, plodding voice like Eeyore, right? Adagio. Dynamic, how loud or soft are they? Some people, when they enter the room, they just take up the whole space, right? They're so loud and boisterous and big. That's their dynamic. Maybe you know someone who's very quiet or shy, right? Very, very quiet dynamic. So much so you may have to lean in to hear what they're saying. Timbre, what is the quality of the sound? String instruments sound different than brass instruments, right? And as human beings, we all have our own unique quality of sound and expression when we interact. Tonality, do you experience this person as very melodic? I personally think the Welsh and the Irish have this very lilting language. The tone is just so melodic. Maybe you've met somebody who has a very dissonant sound. It's like fingernails on a chalkboard. You can't quite put your finger on it, but it just rubs you the wrong way. Or some people have a very flat monotone, right? So all of these musical elements begin to form a composite that tells us something of who this person might be in the world and in relationship. So why might that be important with complex medical populations? Well, as music therapists, we engage in these musical relationships with our patients and offer them repeated opportunities to explore, experiment, and play around with these musical elements. And in playing around with these musical elements, we might shift or change the way we express ourselves. And in shifting or changing our music, either internally or externally, that process offers us an opportunity to maybe engage in more compatible or harmonious relationships with people. So, what are the principles behind the practice? So, music therapists operate with a principle known as entrainment or synchronization. Entrainment is a scientific principle that states that whenever two bodies are in motion, they come in close enough proximity to one another, they will fall into the same frequency, motion, vibration, right? They synchronize. You probably had an experience where you've been walking down the streets by yourself at your own pace, and suddenly you meet up with someone. And in meeting up with them, you begin to walk a little differently. Your pace changes, right? That's entrainment. So in music therapy, we meet the patient where they are musically. We mirror and match the elements of music, their rhythms, their dynamics, their tempos, their tones. And then we use this principle of entrainment to slowly over time invite them to shift or change this internal or external music. And this engagement, this shift and change in their music can often result in a physiological or psychological shift. So music therapists call this term the ISO principle. ISO means equal to, and it was discovered by a psychiatrist actually in the 1940s who noticed that when he began to play music that matched the mood of his psychiatric patients, he could change it slowly over time. And eventually it resulted in a significant positive shift in mood. So to recap, the ultimate goal of music therapy is to incorporate the principles of entrainment and ISO principle into our evidence-based practice interventions and guide our patients towards more comfortable states. It's the natural order of things to move towards homeostasis. That's how the body was designed. And so as music therapists, we repeatedly engage in these musical relationships with our patients and help move them towards an increased homeostasis or more balanced state of being. And over time, that can help alleviate chronic physical and psychic pain.
Thank you, Missy, for that. Marissa, so Missy has just explained some of the applications of music therapy, but if a layperson wanted to use music in a therapeutic way and they're not trained as a music therapist, what are some safe practices that we could all use at home?
Lee, I'm so glad you asked. So as you said, music can be therapeutic, and we have all listened to a piece of music or a song, whether live or recorded, and felt moved in some way. And we know that music itself has an impact on the human body, including the brain, emotion, and movement. And so it lends itself as an appropriate therapeutic medium. It's very important to note that even though studies show general neurologic effects of music as a stimulus, music therapy is an interactive experience where, as Missy described, the therapist empathically observes the patient and constantly adapts the music and the whole interaction to the reactions of the patient, which Missy talked a lot about, so I won't go deeper into some of those principles. And this leads to a developing exchange between the patient and the therapist that forms the therapeutic process and the therapeutic relationship while shaping brain activity and also causing all of these various physiological responses that we're looking for when someone is in pain, physical or psychic, or has other needs. And music can actually cause harm, albeit unintentionally, particularly when a well meaning but maybe an untrained volunteer musician brings music to a patient's bedside without any knowledge of the patient's medical and psychosocial history and not having the training to monitor for signs of danger and to be able to adapt in the moment. So often, we think of the arts as healing, which they can be. They can be deeply healing. And as healing as they can also be dangerous and activating or even triggering when we're talking about bringing music into the environment of vulnerable populations. And to speak to your question about ways that people can use music in a therapeutic way, music therapists do not own the use of music. Um, Anyone can use music in a way that is therapeutic without it being music therapy. So, for example, today um, you'll have the experience of Missy, who obviously is a licensed and board certified music therapist, providing a sound meditation targeted to balance your central nervous system. You can feel free to come back to that anytime you want, that guided experience. And that doesn't necessarily have to be music therapy. Missy's not looking at you and responding to you in the moment. On your own, try practicing deep listening to a song or a piece of music that's meaningful to you. And notice what comes up for you. That can be an exercise in mindfulness, just noticing. Think about maybe a song or a piece of music that you share with someone else and listen to it together. Reminisce about the memory or the association to facilitate bonding. Something else you can do is hum to yourself, which can actually provide a sort of internal massage. And you can always come back to your breath. Try breathing with a piece of music that you find to be relaxing. This will be different for everyone because, contrary to popular belief, music is actually not a universal language because we all feel and experience music so differently. So I invite you to find something that works for you.
Marissa, does a patient, does a patient need a background in music to be able to benefit from either music therapy or using music in a therapeutic way?
That's such a great question, Lee, and something we're asked quite frequently, as I'm sure Missy can attest to as well. The answer is no. Most of our patients actually are not trained musicians, and that's okay because as music therapists, we use frequently live music, sometimes recorded, but we use music. We set up the musical environment for the patient to have a successful musical experience. So, a music therapist might be playing a keyboard, piano, or a guitar or something like that, and they might set up, let's say, a xylophone with, for example, a scale that is missing certain scale degrees so that patients can play any of those notes together and have a successful musical experience. Music therapists also often use a lot of percussion instruments, drums, shakers, auxiliary percussion that really doesn't require any prior musical training. Does that answer the question?
Yeah, yeah. I we're
Lee, I have one quick thing to add as Marissa was speaking, because I work with trauma populations, and it just occurred to me to also remind practitioners that when you're engaging in musical experiences, music can cause harm if the sounds are triggering. And by
Mm,
sounds, I mean sound is stored in the limbic system where we store emotion and memory. So there are certain sounds that are in our physiology that could actually be triggering if we have a complex history of trauma. So again, music therapists are trained to respond to that immediately, right? We are setting up these successful experiences, just as Marissa said, by offering them instruments that we know they can have a success with. And every now and then we get it wrong, right? Maybe we have an instrument that has some sort of emotional context or a
mm,
particular tone that is stimulating something in their limbic system. So we know to adjust. So again, we caution individuals when you're introducing music just to be very mindful and careful with others. With yourself, you'll know right away, that doesn't feel right. It
mm,
feels wrong. You can stop. But ears are the only thing we can't turn off. We can close our eyes. We can move our body away from touch. It's very hard to move our ears to a safer place. So again, I just wanted to add that little
mm.
extra thought.
That's, yeah,
Right.
that's great and so important. Thanks for adding that, Missy. Um, we're going to open up now for questions. I will ask the first question. And I'm going to put it out to Missy or Marissa, either one of you. So I keep reading about active versus receptive music. Of course, one would be where I'm actually participating, playing an instrument or singing. The other, which would be the receptive, is when I'm doing the opposite. I'm sitting back and I'm allowing the sound to come into me. So can you just quickly comment on that or talk about, is there a difference in its effectiveness one way versus the other?
For sure. I'm going to let you take this one, Marissa, because I think it has a lot to do with the brain, right, as well. So we want to talk about what parts of the brain are firing.
Sure, sure. So I would say in many circumstances in music therapy, we're using live music, um, and it is important to know that there are situations in which we would use recorded music. So, or I'm sorry, you asked about receptive versus. I'm sorry, Lee. Can
Well,
you just
that was
remind me?
that was the other question I was going to
I'm
ask
so sorry.
you.
I was answering a different question.
Live versus recorded. So,
I'm so sorry. I wanted to speak to your first point. I also had a private message in the chat, so I sort of tuned out for a moment. Can you just briefly
so,
rephrase? You were asking
so I
receptive
so I have
experience.
so the first question is the active versus the receptive
Thank you. Yeah,
part of
sure.
music.
Absolutely. So I would say there are certain circumstances in which we would use a receptive. We would engage with patients in a more receptive way, and what that would look like is the music therapist providing an experience for a patient where the patient is not actively playing an instrument. However, during these experiences, the music therapist continues to respond to the patient and what the patient is giving us in terms of maybe it's their heart rate or it's a vocalization. Um, to give a couple of concrete examples, a receptive intervention might be when a patient is, let's say, in an active dying process where they're not able to necessarily engage actively in the experience and they're in a more receptive role. Or music therapists also provide procedural support during painful or anxiety provoking procedures using clinical evidence based music therapy interventions to decrease the perception of pain. So, working with the gate theory
Mm-hmm,
of pain.
mm-hmm,
And again, the music therapist is in training, coming back to a term that Missy defined for everyone, using rhythmic entrainment, which is a temporal locking process whereby we synchronize with what we're hearing. So the music there, that would be usually a receptive intervention, particularly if the patient is not allowed to move or due to the circumstances surrounding the procedure, they are awake or maybe have light sedation, but they can't actively play an instrument or engage. In some cases they can, in many they can't. Um, In a more active music therapy experience, music therapists might be engaging a patient in clinical improvisation, which is a dynamic, reciprocal, shared experience of playing music, singing together. Music therapists might engage patients in an active singing experience, songwriting, something like that.
Hmm, that's great. Anybody in the audience have a question? Would you like to, you can either put it in the chat or we can call on you and you can unmute yourself and ask it live while you're thinking about that. I just wanted to bring this back to oncology a little bit and talk about the different applications of music therapy in different stages of the cancer care continuum. So of course, I did a quick PubMed search before we went on this morning, and and I put in music therapy and cancer or oncology were my my keywords. And can you hear me? I've kind of lost, I can't hear. Uh-oh.
We can hear you,
Okay.
Lee. Yeah,
Okay.
we
We
can
can
Great.
hear
hear
you.
you.
Great. All
Just in
right.
case there's any ambient sound in our
Great. All
environments.
right.
But
Thank you.
yeah, we can hear you.
So particularly for fatigue and for anxiety, depression, um, there was a study in the Journal of Clinical Oncology, which is produced by ASCO, on the effects of music therapy on anesthesia requirements during ambulatory breast surgery or for diagnosis or treatment. There were also studies on end of life, hospice, palliative care. There was a study on breast and gynecological cancers that music therapy reduces the fatigue induced by radiation treatment. That was a randomized controlled trial. There's actually a new study that came out a couple weeks ago in the Frontiers in Psychology, and it's a systematic review meta-analysis on music therapy and the psychosocial treatment of adult cancer patients. And again, it's looking at fatigue, anxiety, pain. So some really provocative research studies really pointing to the evidence base around the clinical application of music therapy. Any questions? Let's see, we have.
I actually, if it's all right, Lee, I was noticing that Anne had asked about deep listening.
Yes, please.
And Marissa, definitely, I definitely want you to weigh in too, but I just wanted to differentiate. The term deep listening, I can concretely say, I know that this is a term used by pastoral care and chaplains practice this deep listening. So I want to be clear about there are probably some semantics surrounding the word deep listening, and the practices might look and sound very different. I think as music therapists, and you'll have a little bit of this experience in the sound bath, when we're speaking towards deep listening, we're speaking about what is it like to take in sound differently and on a different level. And so the reason sound meditations have become so popular is because of entrainment, and our bodies are in motion and we are vibrating frequencies, right? We resonate. When you're using different drone sounds, which is one continual sound, you have this experience of entraining to this very consistent frequency. And what happens over time, specifically with sound meditation, is that you can actually entrain brain waves. And so you actually drop from alpha state or beta state, really, which is the conscious state of thinking and doing, right, in our everyday lives. You shift to alpha, which is the state right between wake and sleep, right before you're not quite awake, not quite asleep, maybe even into theta or delta. And so that experience that transpires is a listening that's happening on a physiological level, not on that mental level. And so you experience it differently, and some might refer to as deep listening. But another way to practice deep listening is just to listen to the drones in your environment. A fan is a drone. I mean, we've learned this so much with Zoom now because our mics pick up everything. So just taking a moment to be quiet and training your ears to hear differently, listen differently, can also offer you that altered state, which is that mindful state that we often experience in meditation.
Yeah, that's a great point, Missy, because in the mindfulness-based meditations and MBSR in particular, there are hearing meditations where you take in the sounds within your breath, your heartbeat, maybe the stomach gurgling, and then you start to go outward and you start picking up the ambient sounds. So that's a great point. We're going to start to wrap up. I want to keep on schedule, but we have a really great question that we need to address. How are we delivering music therapy during social distancing and the quarantine restrictions? That's a whole nother webinar.
We aren't, but we are.
We are trying.
We are struggling. Marissa, you can tell, I mean, the delay, it's a 2 to 3 second delay. So it's very difficult to engage in a parallel music making experience. Yeah. Yeah.
Marissa, do you want to? Are you frozen, Marissa?
Oh.
See, this is exactly
Oh, there she is.
There we go.
Okay. Are you there, Marissa?
I think she's frozen again.
Oh, no.
Just some of the challenges of delivering therapy.
Well, until she comes on board,
Zoom.
I will also add that, you know, when we're talking about receptive versus active, the principle of entrainment is possible virtually, because it is possible for me to offer someone else music and for them to be able to receive the sound. Zoom offers us original sound, so we get more of the frequencies. But in virtual experiences, we lose this, we don't get the whole spectrum of sound. And so it's not the same as being physically in a room with someone. And also our bodies are hearing it, but they're not hearing it on the physiological level. We can't feel the vibratory feedback that we get when we're in a room with a singing bowl. And so that is also potentially a little bit, it can inhibit just a little bit of that experience, because our mind tells us that we're seeing and hearing it, but our body knows that we're not. I think someone beautifully said, we're used to being in each other's presence and each other's absence, but we're not used to being in the presence of someone's absence. And so as music therapists, we are really experiencing that dissonance of that.
Yeah, absolutely.
Did we lose Marissa completely? Oh,
no, she's come back.
Oh, okay.
Marissa, do you have a really quick comment, because we're going to wrap up in 30 seconds?
I think Missy covered it.
Okay, all right. So these we have a reference list for you, and we have the PDF files of some of these more important randomized controlled trials for music therapy and in the oncology population. We are going to email these to you. So later today, we have your email, and we'll send it out so you can have these for your records and take a look at them. I would really like to thank our two guests, Marissa and Missy, for joining us today and giving us that really quick little, bite-sized glimpse at music therapy, the extra training that the music psychotherapist go through in order to provide the music therapy in clinic. And thank all of you for showing up and spending your lunch times with us. I hope you'll join us again next week. Next week's topic is health disparities in cancer care and how yoga can help build community and be used as advocacy. So,
thank you, Lee.
Yeah, thank everyone so much for coming.
Thank you.
Yeah, have a great day.
Take care.